I noticed on your website, what I liked about your company is you go from the beginning all the way through to the palliative care. What does that involve?
Yeah, so I mean, we do anything from a simple companionship case to someone who's totally bedbound and needs, complete care. And we do partner with some local hospice companies. Hospice, some people believe that hospice is there kind of 24/7 for you at the end, but that's not always true until the very, very end. So we're able to kind of sit with them and be with them in between when hospice is not able to be there. And I do, when I meet with them, that's one of the areas that we really go in depth to kind of prepare them, not only for some of the things that they're going to see and come across, and to prepare them for the losses. It can be difficult for the caregivers as well, especially if they've gotten to know their client and lose their client. So I try to prepare them for some of those things. And we talk about, some of the things that are really important for those bedbound clients. Simple things like making sure that, we're turning them every 2 hours and they're watching for skin breakdown. We, talk about things that they can do if they're struggling to breathe. A lot of people towards the end, they get unusual breathing patterns, or that what they call the death rattle, that awful hacking cough. So I try to not just warn them about those things, but give them tools like raising the head of the bed, turning a fan on to get the air circulating, just little things that they can do to kind of make things easier for the client as well.
So you brought out a good point about hospice, because I think many people feel that once they enter into a hospice program, it provides that 24-hour care, but a lot of hospice doesn't. They do a lot of the nursing part of it, and they come in for a couple hours, and that's where your company can come in
Yes,
between time,
that's correct. Yeah, they generally will come in, they do the more of the medication management. They make sure, if they do have skin breakdown, that those things are being addressed. But a lot of times those hospice patients, especially if they're bedbound for a significant amount of time, they really need someone there making sure that they're turned every 2 hours and they're staying clean and they're staying dry. And even just being there for the moral support. Going through hospice can be a really isolating situation. A lot of family, they don't like to see their loved ones like this, and it can be very isolating for the patient. So even just having someone there to hold your hand and to vent your feelings and your frustrations to is really important.